to another exciting edition of Edak Willie Show. Today we want to talk about bipolar disorder. A disorder that is not so common. You don't get to hear about it every now and then. Dr. Ogbolu is in the house to discuss about it and educate us on how to spot it and save a soul probably. Stay with us. Doctor, welcome to our program.
Good afternoon.
Please introduce yourself.
My name is Dr. Raphael Emeka Ogbolu, consultant psychiatrist with the Lagos University Teaching Hospital.
It's good to meet you. Today we are talking bipolar. A very interesting topic, I might say. And our doctor here is going to do justice to it. Many of you or many people do not know what bipolar is. We will know today. Doctor, take it from here. What's bipolar?
All right, bipolar disorder, okay, is a spectrum of disorders whereby people's mood is affected. It affects mood, behavior, and the way you think, okay? And there are two extremes, okay, as the name implies, bipolar, two poles. So people tend to swing between two poles of being excessively happy, uncontrollably happy, okay, which we call elation, and then another pole of being so sad, okay? So the mood can swing between these poles. So that's what makes it bipolar. Of course, when one is on the pole where you're sad, there are a lot of other features that come with that. When you're on the pole where you're excessively happy, there are other features.
Are there people that are prone to it?
Yes, we do know that there's a strong genetic tendency, and some reports have said that if you have a parent who has a bipolar disorder, okay, you are 25 to 30% at risk of developing bipolar disorder. If you have two parents who have had bipolar disorder, you're 50 to 75% at risk of developing bipolar disorder. So we do know that, yes.
Is there any age level that it manifests?
Well, interestingly, over the last 50 years or so, we've noticed that the age at which it starts is gradually reducing.
Reducing?
Yes. For several factors, okay?
Before you used to start around what age?
Usually between 20s and 30s.
Okay.
But now we see teens, early 20s, even presenting for the very first time. This is global, not just Nigeria. Okay.
You said it's reducing. It's not reducing now.
As in, they are present at a younger age.
Okay.
The age at which it starts is decreasing.
Okay.
As against in older ages. So it starts earlier, in other words, than we used to see it start.
Wow. Okay. Is it like male are more or female?
No, both sexes are actually at risk, okay, approximately equally.
So how can you spot when somebody has this?
All right, now, okay, when you have bipolar disorder, you could either be in the lower side, which we call bipolar depression, okay, or the extremely happy side, which we call bipolar mania, okay. Now, in bipolar depression, what you will see is the person is just unhappy, very sad. It describes the mood as sad. Nothing seems to be able to make the person happy, okay? I mean, you crack a joke, he can't lift his or her mood. Together with this, you have problems with sleep. The person finds it difficult to sleep. Usually the sleep pattern is such that even if the person sleeps in the morning, he or she still feels unrefreshed, as if he or she hasn't slept. Okay. And then you find out that increasingly the person wakes up in the early hours of the morning, earlier than usual. If, for instance, someone who used to wake up at about 7, you find that he wakes up about 2, 3 a.m. Okay, so you wake up earlier than you used to. The person has no interest in things that he or she used to enjoy doing. Okay, if you used to enjoy watching movies, reading novels, you no longer enjoy doing that. Okay, and then you notice that the person finds it difficult to concentrate. If you're reading, particular students, okay, you may be reading, studying, you can't concentrate. You know, you can't seem to remember things, okay? And then also there's this, for most people who are in the depressed side also, they have a lower sexual drive, okay? and things like that. So all these put together is what comprises the depressive aspect of bipolar disorder. Now, the other aspect...
before we get to the other aspect of it, yes. Is there any kind of food? Can food contribute, or maybe
no, food is not known to contribute, even though some, you see some sites that will tell you that some food types can help to improve mood, okay? But not that they are not known to cause.
It's mainly hereditary?
Largely. Sometimes we may not find any family history or genetic predisposition, but oftentimes we do.
Okay, let's go to the other side of
the other side, which is the bipolar mania. This person is excessively happy. You just cannot control the happiness. It's beyond the usual happiness you will see.
It's better to be happy than to be depressed now.
It's supposed to be a good thing. Okay. But the problem is the happiness is so intense that we call it elation. Okay. You know, and then things that come with it. This person is on top of the world. He feels he is the greatest person in the world, okay, and believes so, okay. The elation comes with restlessness, can't stay in one place. There's so much energy this person has. I mean, some people in the state of bipolar could walk from here to Lekki and will not feel tired. They have so much energy. Yes, that's what happens, okay. And then the person becomes embittered. Things that you ordinarily will not do, you throw caution to the wind and you do it. And then you see people who take increasingly risky behaviors, okay, things that ordinarily in their usual state of mind they wouldn't do, okay. Then some of them become exceedingly irritable. Slightest thing that you wouldn't expect to provoke somebody, the person will let loose, okay, and extremely angry and all that. So,
is there any violence in
sometimes, yes, because these people, I mean, somebody who believes that I am, for instance, the president of the world, okay, you can't challenge me. I mean, for me, it's just not acceptable. So, you know, because that is the way the person's mind is operating. And usually in this state as well, so many things are coming through the person's mind. So many thoughts just keep rushing. Before I finish thinking of something, another thing comes, okay? And so you see them speaking very fast.
I'm beginning to be very, very scared because it's sounding as if a lot of people have bipolar at a very minimal level, I should say.
Now, the bipolar spectrum of disorder includes an in-between level, okay, which we call hypomania, which you may see oftentimes but may not know, okay? Hypomania may not require hospitalization, okay, as against someone who has mania. So quite a lot of people you may see walking around the road may have bipolar, okay, hypomania. Now the thing with this disorder is that it usually comes in episodes.
In episodes?
In cycles, yes.
Okay.
So it comes, even without treatment, sometimes it could go. And then the person is back to normal. Then after a period, it comes about again. Okay, as a matter of fact, in some parts, some literature, some studies have found out that there even seems to be a seasonal variation. Some people say that you see more of the experience, people who have bipolar experience the depressed aspect between March and May, okay, yes, and also between September and November, whereas they experience the manic aspect during the summer period. So there have been, I mean...
How about full moon? I heard something about some people getting crazy during
those
full
ones
moon.
are still fictional at best, you know. Okay. So that's really it, okay? But there's no doubt that it is present here. We used to think, oh yes, very much.
Is it present here?
We see it quite often. Initially, the thought was that it was more commoner in Europe, Americas, or not, but we're seeing a lot of
But are people aware to know that, okay, let me go and seek treatment, let me go to the hospital for this?
Apparently, the lack of people coming to the hospital, people coming to seek treatment, is the reason why we thought we didn't have it.
Okay.
With a lot more awareness, okay, not where it should be anyway, but at least people are becoming a little bit more aware. So
if you spot someone that is, is showing this kind of behavior, how can you help the person? Maybe tell the person to go to the hospital so that the person doesn't take offense, you know?
That's a challenge, really, because most of the time, except the people who are in the depressed pole, okay? Someone who is depressed, okay, doesn't enjoy being unhappy, being sad, okay? So you're more likely to be able to convince that person to go
Doctor, please hold it out. Let's take a break. When we come back, we'll continue from here.
A lot of times, our religion preaches that women hold a subordinate role in a relationship.
He said, what kind of a man will raise his hand against the woman? What is happening in that relationship? You must ask.
Yes.
I want to say this.
Let's take a break. When we come back, we'll continue from here. There's something called spring cleans. Once in a while, you give your system a rest. And how do you do that? You do it by eating only fruit.
And I was staying there for a while. Nobody was coming to turn me. I decided to do the turning myself. And I just turned, and next thing I had a snap. Until my father came, I told him, they rushed me to the theater.
Welcome back.
Well, they are born with it and they are going to live the rest of their life with it. Okay? So
Welcome back. Doctor, as we were saying, how can we spot the people that are living with this condition?
Yeah, like you mentioned earlier on, I mean, it seems as if, the way I was explaining, it seems as if everybody could have, bipolar disorder.
Which is scary.
Yes, but the truth about it is, number one, the behaviors that warrant someone to see a psychiatrist or psychologist are usually normal human behaviors, okay? But it's only that it's either excessive or it is too reduced, okay? So that's it. So, and then not one of these things alone will make you say that this person has bipolar. Like I said, it affects mood, way you think, and behavior. If you see somebody who, in the depressed state, you're sad, very, very sad, you cannot just make yourself happy. Whereas on the other side, you're excessively happy, uncontrollably happy.
Sorry, when you talk about being sad, can that lead to the drug abuse?
Sometimes. Substance abuse, drug abuse is one of the other conditions that have been linked with people who have bipolar disorder. Because when somebody is depressed, okay, you're sad, life is not worth it to you, you feel guilty, you don't look towards the future, some people take to drinking, okay? And then on the other pole, when some people are excessively happy, I mean, they throw caution to the wind, they even drink, they will drink more than they ordinarily would. So both poles can be associated with drug abuse.
Is it preventable, bipolar?
Now, bipolar disorder, like I said earlier on, it has a genetic, some of them, not all cases, okay, have a genetic predisposition. So it could run in families, okay? Now, if you do know that it runs in your family, it doesn't necessarily mean that you will develop bipolar in your lifetime. Okay. However, if you now, through your course of life, you now experience significant amount of stress, it can now bring forth that bipolar disease. And once it starts, it started.
Is it curable?
Talking about cure is like saying is hypertension curable? Okay. Oftentimes, we talk about being managed, just the way you manage diabetes, the way you manage hypertension. Okay.
So
which means that oftentimes with regular follow-up treatment, use of medication, they tend to do well. Okay. But the problem is usually they need to use medication for a long time, sometimes for the rest of their lives. And so because of that, some may skip medication or stop medication, and that's when it comes back. Okay. But for those who stay on medication, because we have drugs that are actually effective in treating. So for those of them who stay on medication, they tend to do well. They could live meaningful lives.
Okay. Is it only medication, or are there other means of treatment?
Yeah, I mean, medication and what we call psychological treatment, psychotherapy, okay, counseling, psychoeducation, they're all put together as a package, okay? So not just the drugs alone, okay? And also, like I mentioned, stress management is also part of the treatment.
Okay, is this common with students? Because as we are talking now, I'm just looking at students that, they are not doing well in school and all that. They could be depressed, and so is it common amongst
Definitely them? It is. A lot of times, sometimes people will start off with one, usually depression. Okay? Start off with one of the poles, depression. And then over years, you now find that the person begins to also show the other pole. So, and then when someone is depressed, particularly a student, like you said, there's no energy to even get out of bed in the morning to go to class. There's no ability to concentrate on what you're reading. You read, it seems as if you can't remember what you're reading, okay? You're tired, you're not interested in going to class, okay? So all these things, which are the symptoms of depression, of course, will result in the person not doing well academically. So one of the conditions for you to say that this person has bipolar disorder is that it has to affect the person's functioning.
And the person cannot help himself.
He can't. You see, as much as, because that's the biggest problem, one of the challenges we have in managing bipolar disorder, as well as other emotional problems, is that people think that the person can snap out of it. You see relatives or family members
say, why are you behaving like
exactly.
this? Get over yourself and all that.
That's wrong, because if no one will want to be depressed, it's a horrible state to be in. So the person ordinarily will want to snap out of it, but cannot. They need assistance to be able to snap out of it.
So is bipolar linked to other ailments? Or?
Yeah, it has been linked with, like we've mentioned, drug abuse, okay? Particularly substance abuse is one of the ones we've noticed it to be linked with. Some people who have the depressed aspect of bipolar could also have symptoms of anxiety, okay? Then of course, a lot of them could develop insomnia, not being able to sleep at night, okay? So these are the common things that, of course, the depressed aspect of bipolar is, the biggest fear is suicide, that the person will not harm him or herself or someone close to him or her, okay?
So how can they be helped?
Yes, I mean, the first thing is to recognize if you or anyone you know has these group of symptoms put together, okay? Has 3 or more of these. One, someone whose mood is either too low, okay, cannot just be made happy, or is excessively happy. You will know the excessively, I mean, it's just not controllable, okay? Together with low energy, if it's depressed, or excessive energy, if it's mania. Inability to concentrate, okay, or having too many thoughts coming to the mind, okay? In people who have depression, they sleep, but when they wake up, they don't feel refreshed.
Okay.
So you find someone who tells you, I used to wake up at 6 a.m., now find myself waking up at 2, 3 a.m. Okay, I just can't sleep. Those are symptoms of depression as well. Whereas the person in the manic phase does not have any need for sleep. He doesn't sleep, but in the morning it's like he's even slept better than you and he's up and about. So there are two opposites, you understand? So what you see on one side is the other opposite that you see on the other side. The problem with why bipolar is very important that we recognize is in a state of bipolar disorder, mania, okay? People tend to take decisions that they would not ordinarily take.
And most times it's dangerous.
Sometimes dangerous or regrettable. We've had people who in that state of mania, because they feel they're on top of the world, I want to just throw a party. And then some have spent all their life savings. Some have begun to give out monies, their properties, because they feel they have too much. They own everything in the world.
Wow.
So only when they recover, they now regret it. We've had people who have destroyed their certificates, destroyed things in that, yes. So that's the fear, that's the risk. Some people have ended their marriages because they were in that state of mania. So usually the person may take a decision that he may not be able to reverse. That's the risk in mania. Whereas the risk in depression, they could also take risks, but the problem is there's a risk of suicide. The person may end his or her own life.
Doctor, this thing that you are saying is so serious. It cuts across almost all aspects of the society, of the people that we know.
Yeah.
So are there centers, or where can people find help? Or what is being done about it?
Now, one of the challenges we have is that we have a scarcity, in quote, of trained personnel to handle these things. I'll give you an example. Up till last year, a year or two ago, we had just about 100, roughly, averagely, 150 practicing consultant psychiatrists in Nigeria for a population of over 150 million. So
for
that
such
tells
sensitive...
Exactly. Again, because like you said, we used to think that these things were not really with us, but we are seeing more and more of it in our surroundings. So we're encouraging more people to specialize in that area. But for now, what you need to do is visit specialist centers that are known to have psychiatrists. When you get there, usually you will get help. So that's the message, really.
Okay, doctor, how can people help other people? Because most of the time, you see people abusing people with this kind of symptoms. But all they should know is that these people need help. So how can they do it?
Yeah, if you happen
so that the person will not be offended.
To tell you the truth, the person who has depression, you can manage to convince the person to at least seek help, okay? Because most of the time, they are not happy that they are not sleeping. They are not happy that their energy level is low. Okay. So you could use that to get them to seek help, okay? But the challenge is the person who has mania because he's enjoying himself.
Yeah.
So it's like you telling somebody who is, hey, nothing is wrong with me, I'm happy, and you're telling him to go to the hospital. So in those cases, usually you have to put a little bit of coercion, okay, if you really want to help the person.
Okay.
Try and force it, okay, to an extent, to get the person treated.
Because here, if you just mention the word psych, they'll say, yes. You know, it's a big problem. So that's why I keep saying, yes. Is there any other way or any other word that one can use to cajole the person, not like they are going to see a psychiatrist?
Well,
psychiatrist means that the person is mad. You are saying I'm mad?
Well, no, we don't like to use that word mad. Okay, good, but that's the lay reasoning. You're right. But the truth about it is, it's difficult. Okay, we're hoping that enlightenment programs like this, okay, will be able to pass the message across. Because the fact there is this: every single one of us is at risk. There's nobody that is immune for an emotional.
It's like all of us have a little of that.
Well, they say that. You know? But the truth is, nobody is immune from developing an emotional disorder because there is no life without stress. Okay, how it now manifests, some people will have stress and they will manifest with depression. Some will manifest with bipolar. Some will manifest with substance abuse.
Is it stress that triggers it?
Oftentimes, stress is closely linked with emotional disorder. So it's inevitable. So the earlier people get to forget about that stigma, yes, it's difficult, but you need to forget because everybody is at risk. And if you ask a question, you're not likely to see any single human being that does not know somebody who has had an emotional problem. It's very unlikely. That tells you how rampant it is.
Yes.
So, I mean, we have to try and get beyond that, okay? And yes, people are still skeptical. You say psychiatry, I mean, yes. You could use emotional disorder, behavioral problem, okay? Or whatever, insomnia. Get the person to the hospital. Just try, because that's where the solution starts from.
Thank you so much, Doctor, for coming. This is quite enlightening.
Thank you.
You've heard it all. If you know someone or if you want to be of help to somebody, do something today. We'll be right back. Medicine in your kitchen. Yeah, what you eat. Keep saying. This is bitter leaf. It is #1 first aid to any stomach problems.
Every day, different stories of extramarital affairs. A man just killed the wife because she was caught cheating. He said because the wife asked for the money, he couldn't provide the money. The next thing she did was to sleep with a neighbor. I ended up slaughtering her.
Medicine from your kitchen. You are what you eat. Today I want to show you what you can use cloves for. Cloves, it's one of the spices that they use in making pepper soup. So you get about this quantity cloves. Go to a market, you'll see it. All you do is that you pound it. Pound it, pound and pound till it turns, you powderize it. When you powderize it like that, you get some quantity of alcohol, kai, if you like it. Any alcohol of your choice. You try to get the real powder out and leave the chaff out of it if you want, as much as you can. Or just put everything there anyway because it's still going to ferment. You leave it for like 1 day for it to extract properly. What you use it for? The other day I went to see the dentist. I went to see the dentist out of curiosity. It was like, what's wrong with you? I said, nothing, out of curiosity because they've been talking about seeing the dentist, so that's why I came. He said, okay, let me see whether I'll see something. She was actually pulling at my tooth, washing, swishing, chopping, pack. You can actually see some plaques coming out. But to her surprise, my teeth, none had any problem. So, with all the sugar and everything that you eat, your children, a lot of people are coming down with toothache these days. And you might want to ask some people that have this problem, that it's not funny. Toothache can be so painful. So if you have this, like I've prepared now, you use it to swish your mouth. Just a little quantity. I didn't say drink it too. Just take a sip, swish it. Hold it for some time, keep doing like that, maybe 3 or 4 times a day, keep doing it. After some time, you will not feel any toothache again. Some of those bleeding gums and all those things, they will heal. But I'm not saying that you shouldn't visit your dentist though. Remember, we are talking about medicine from your kitchen. This can always serve as a first aid for that toothache, those pains that one cannot describe. That's what I have for you today. I hope you've learned a thing or two. See you next time. An interesting topic, I must say, we had today. I hope you had a nice time. This is where we come to the end of today's program. See you next week. My name remains Edak Willie, and thank you for watching.